So we all recognize education is key when attempting to soften the impact of a change and make it successful. In this section, our panelists will share strategies they used as well as how they assess the effectiveness of their programs. Our first question is, share one strategy that you used to prepare for the adoption of the glycemic management software. And Jennifer, if you would begin.
I think when you are preparing for adoption of any sort of software like this, the identification of the key stakeholders for multiple disciplines early in the process is critical. For the end-to-tool implementation, Marnark does a great job with helping your team understand what has worked best with past implementations, and we tried to mimic those success stories. We set a clinical tri-partnership between a medical staff, nursing, and pharmacy leader to help drive the implementation plan. And with the vendor's assistance, we had a routine implementation team meeting with report outs from subgroups regarding the technical and clinical build, as well as continued planning for education. We tried to identify time to those as those issues were identified. And I think it's important, I've said it before, but I have to say it again, to have that strong information technology engagement from several teammates due to the importance of how the order sets and nursing documentation are implemented. The team, we met more frequently as we moved toward go live and spent quite a bit of time in the final stages of ensuring that that education from nursing and providers and communications were complete. With the end-to-tool implementation, nursing education had to be completed at a high compliance rate, and so that was a lot of the focus as go live approached. So we tried to prepare with that team and just make sure that we had that team in place that could push all the initiatives as quickly as possible.
It's amazing that it's definitely a team approach and not any one person that is going to make this successful. Megan, what strategy did you use at HCA?
Well, I think as Dr. Paul, mentioned earlier, it's just getting nursing and physician, to buy into the why. Why are we doing this? Why is this going to be a better process than what we are already doing? Any change is difficult. It feels burdensome. We've done it for years and years and years, and that doesn't mean it's always best. So really trying to explain, to the nurses as why we're doing this, why we're changing, have them buy into how this is going to not only make their lives easier, but also give better patient care, as well as those physician and APP colleagues as to, how this is going to help our patients get them home faster, get them better faster, and just being present and answering those questions, in real time. I have found over the process of implementing this team 8 to 10 years ago that, just the questions don't come up until it happens, right? And so you're never going to be able to prepare at the beginning. As Jennifer said, trying to get compliance in education is huge. But until they actually have to do it with their first patient, there's going to be things that come up that they never thought of. So really just trying to walk right beside the nurses and our provider colleagues to make this successful, I think was a strategy we tried to lean into.
Your team clearly has a high level of engagement and ownership as you work to make this successful. Christy, what would you share about a strategy used for UPMC?
As I mentioned before, I think it's what we had an opportunity to do better with physicians, but for nursing, we used a super user strategy where we really had each unit identify 2 day shift and 2 night shift super users, so 4 nurses per unit, which ended up to be about 300 super users across the system. And then those super users got a higher level of education beyond just the self-paced modules that all nursing staff got. And our hope was that they got a little more comfortable with the product through some interactive webinars, and then could provide that at the elbow support on their units to the team. So I think the super user approach was our best strategy at go live. And we also relied heavily on our nurse educators to, be part of that super user team, in addition to the bedside nurses from the unit. So super users and leveraging the nurse educators to be, we'll call them super users for train the trainer, that provided that extra support on the units.
You guys have such a recognition and place such a value on supporting your nurses at UPMC. It's very cool. Final question, how do you evaluate the effectiveness of your glycemic management program? And Megan, I'll ask you to start.
So I think one of the things that is also great about EndoTool is that they provide you analytics that are real time and can be run independently without a data analyst. So I know previously data on a paper protocol is such as hard to get your hands on. And so, EndoTool does have analytics that we monitor closely, quarterly, even individual patients that we come across that we have concerns about. And so, we really try to watch those metrics and then also keep up with our nurses as we're rounding on the units, as we're, going into different units. How's it going? I still ask my CVICU even a year later, how's it going? And as I have mentioned to this team earlier, there's still things that nursing reports back on that we try to work closely with the vendor to just try to make their life easier as much as possible. And then, also one of the things that we really monitored closely at the beginning of our implementation was our length of stay. And so does our team, the glycemic management team, are we helpful in getting patients home faster? And, the data was able to show that, yes, we were able to get patients home about a half a day sooner. And so with the help of IV insulin and time, to goal and on insulin drips really helped aid in making that an effective process. So, the data drives a lot, but also just how can we continue to help our provider colleagues with using the tool, but also nursing to make it better for them.
That's amazing. A half a day decrease in length of stay is truly stunning. Christy, how do you evaluate the effectiveness at UPMC?
So in addition to using the fantastic data analytics that Monarch does provide, which is fun to dig into, we round on our nursing team. So between our EHR team and myself, we round and survey them on their pain points, ask them what it's like taking care of a patient on an insulin drip, get some feedback. Is it better than it was before? Which we have gotten in surveys that they much prefer using EndoTool than the way we used to do it. And then providing some of that bi-directional data with the nurses as you round. One of the things that we find is that nurses just don't like taking care of patients on insulin drips. So we were getting some anecdotal feedback from our provider colleagues that nurses didn't like EndoTool. So we dug into that data a little bit more, and what we found truly was that nurses don't like taking care of patients on insulin drips. However, if given the choice between the way we used to do it or the way we do it now on EndoTool, they preferred the EndoTool method. But we do get, ask them what are the pain points. We've gotten rounding details like from our cardiovascular ICU that they were surprised that they weren't seeing as many 2-hour rechecks on patients that they thought had very stable blood sugars. And we were able to work with the Monarch team and look at our data and realize that we were able to make a parameter change to get those patients out to more 2-hour rechecks and decrease some of that nursing burden. And the nurses definitely felt that and saw that the next time we rounded on them, they noticed that difference. So we do, I think, rely a lot on, the data analytics that we're getting from Monarch, the feedback that we're getting from the end users, and then being able to communicate that to them to make changes and to show them, where we really are. I mean, it's nice to be able to be on a nursing unit and that be able to tell them that, we have almost a 50% decrease in blood glucose checks on patients on insulin drips than we did before we went live because of, our decreased length of time on drip. because they're only seeing things shift to shift. Like they take care of a patient on an insulin drip on a shift. They're not necessarily seeing the bigger picture. So it's nice to be able to provide them with that data and show them the difference that this tool is making.